So today we're going to be doing a microphlebectomy. I've already gone through the standard vein H&P with my patient today. The provider has come in and marked her leg, and now we're going to get everything set up and ready to go. I have my pre-made microphlebectomy kit with me. I leave this on the counter. It's got everything that I need to dress her leg after we're done with the procedure. Now I'm going to pull out a gown and sterile gloves for my provider when they come in. I open them up and have them ready on the counter. I don't open them fully because they are sterile, and a micro is a sterile procedure. In addition to my gown and my sterile gloves for the provider, I've pulled out a pair of sterile gloves for myself, which I will use to set the patient's leg up sterilely. I've pulled out a sponge. Before the procedure, the patient's leg gets completely washed sterilely. Then a sterile sock gets put on their foot before we drape them. I've pulled out every instrument that our provider will need to complete the procedure today. I have an 11 blade, which is used for making the small incision into the leg where the vein is. A spinal needle, which will connect to our tubing to pump the tumescent fluid into the leg to numb the area. I have 2 hemostats, which will be used to grab onto the vein and kind of spin it out after it is hooked out with our hook here. Now I take everything that I have for my setup and I uncover my sterile tray. We drop everything on there without touching it because this is a sterile procedure. I will also open and drop both of my drapes onto the tray as well so that we can sterilely drape the patient after we wash her leg. The last thing I'm going to drop on my tray is going to be a needle nest. This is something that the provider can stick onto the drape and place all of their sharps into to keep the area safe. Now that I have everything placed onto my tray, I have a sterile pair of gloves out for myself, which I will be using to set up the tray since everything is all piled into one area. Before I go sterile, I'm going to open my sponge and leave it in the sink so that when I do go sterile, I can grab it right out and set everything up. I turn the water on and let the sponge get a little wet so that when I grab it, it's ready to go. Now I open my sterile gloves and put them on one at a time, being careful not to touch the end of them where my hands are. Now I will readjust everything on my tray. I like to place everything in the order that it will be used. Before I place the drapes down under the patient's leg, I will be putting their sock on, so I like to keep my sock here on the top, easily accessible for myself. Next, I have the tubing ready because at the very end, when I'm done draping, I will connect the tubing for my provider. I make sure that their syringe is ready for them to fill, that their spinal needle is sitting out next to it for them to connect to the tumescent. I place both hemostats next to each other, the hook and the blade all in a row. Before washing and draping my patient's leg, I went ahead and put my hair back in a ponytail. As you can see, I have very long hair, and because this is a sterile procedure, we want to keep it back away from us so that it doesn't touch the patient's leg or interfere with our tray in any way. I'll hold my sock open very wide like this so that I can slip it onto my patient's foot without her foot touching my fingers because I am still in sterile gloves. So I'll have you lift your foot a little for me so we can get this sock on. Now that I have the sterile sock on, I can use that to my advantage by helping her hold her leg up while I wash it. So next I'll take the sponge and I will wash my patient's entire leg, starting over the area that we will be doing the procedure on, circling my way out and making sure not to overlap. Now that her leg is sterile and washed, I'll place a drape down under her leg. I try to hold her leg up for her as long as possible because I know that it can be uncomfortable for them to keep it in the air. Okay, go ahead and hold your leg up for me for 1 second while I open the bottom up. Okay, and you are good to rest it. Next, I'll take my second drape to drape over the top of the patient. And I will tuck the drape into the bottom of their pant leg to hold it away from the area that the provider will be working. Lastly, I will take the hemostat over here that's holding my tumescent tubing. I will be breaking sterile with one hand. I use my right hand because I'm right-handed. I clip it onto the drape. Now that this hand is no longer sterile, I will grab the tubing off the tray with my one sterile hand and connect the tubing for the provider. The last thing I do before bringing the provider back in for the procedure is set their tray up next to the bed and make sure that the pedal is out and accessible to them so that they can come in, sterilely gown up, and do the procedure.
Once you are sterile, gowned, and gloved, you can either sit or stand depending on where the vein is on the patient's leg. You take the tumescent tubing and you hook up the spinal needle that is already set up on the tray for you. You then take the needle nest, which you do not have to do, but it is nice to have because you can stick your tumescent needle in it after you are done tumescing. Once the tubing is hooked up to the spinal needle, you then take the empty syringe and you fill it with the tumescent solution. As you can see on this patient's leg, I put little hashtags where the vein bulged at. However, you can draw a circle, you can draw a line down the vein. It doesn't matter, you'll find your own preference. I like little hashtags to know exactly where I want to put my scalpel. So once the syringe is full of the tumescent solution, to the very distal part of where you mark, you put a small wheel, little pinch here. And then you take your spinal needle hooked to the tumescent tubing. I like to do bevel up. insert it into the skin, and you follow the vein up. Why you start at the very distal portion is because the tumescent solution does follow the vein up a lot of times itself. As you can see, my needle's still here, and the tumescent solution is following that vein up. This allows you to poke the patient less times. You put the tumescent solution in a different plane than you do for a RF or a EVLA. This is between the superficial layer of the skin and the subcutaneous layer of the skin. As you can see, the skin looks almost like an orange peel. It's the pude orange appearance of how that tumescent looks in the leg. So that is how you know you've gotten the tumescent in the correct plane. With the last hashtag, you want to make sure that you get tumescent to the proximal portion of this, proximal up the leg, because you can sometimes, when you get in the spot, if the vein's being pulled, the patient will feel it, so you want to make sure you tumesce past this area. So this patient had a total of 2 tumescent pokes, and the whole vein has been tumesced. You then take your scalpel, and you want to make sure when you're making any incision in the leg that it is a vertical incision with the patient's leg. This follows for aesthetic appearance of the leg. Your eye, when you make a vertical incision, it's a much better appearance than if you were to do a horizontal incision for healing. So small incision here. I do about halfway, as far as my scalpel blade goes halfway into the leg. You can also put your scalpel here in the needle nest. I then take my surgical hook. Once you get the vein on the surgical hook, you clamp. If you don't get a big chunk out of every spot, that is okay. The purpose of the microphlebectomy is to make little micro incisions to disrupt the vein. Once that vein is disrupted, it will naturally stop functioning. So I'm moving on to the next spot. So as you can see, the vein is clear once out of the leg. Almost looks like a teeny worm. When the MA does your preparation for your tray, they will put 2 hemostats on here. You can use a large hemostat, which is this size. I like the mediums, or you can use the smallest hemostat. So there's 3 different sizes, and you'll find your own size that you like. But the purpose of the hemostats, of 2 of them, is you want to clamp and then continue to twist back and forth. And this will loosen the vein from the tissues and help it come out extremely easy and painless for the patient. Since that was such a big chunk of vein, you don't have to go in every little place that you mark. I'm going to skip this one and go up one. This is the vein on the hook. Clamp with the hemostat. Turn counterclockwise. Take the other hemostat, clamp under, and turn clockwise. And what you do is you keep doing this back and forth, and you'll feel the vein loosen until it breaks off. When you're done, the incisions may weep a little bit, and this is not necessarily blood when I push on this. It's tumescent solution mixed with the blood. If you have a significant amount of bleeding, which sometimes you can with a larger vein, you can put a suture in it. Also, some people do prefer to place a suture, but when you're making micro incisions, I have found that these incisions heal perfectly fine without a suture to approximate the wound margins. So if you get a close-up here, it is literally less than a centimeter incision that healed just fine. And I can show you, this patient has had a micro right here. Is another microphlebectomy from last week that has healed. And as you can see, her incisions, you can't even hardly see, and this is only a week out. So they just scab over. Your patient may have bruising that can last 1 to 2 weeks from the micro, but this will heal as well. As far as permanent discoloration or dyschromia, that does not happen with the microphlebectomies. And once again, the microphlebectomy is for that large varicose vein that doesn't go down after the ablations, that can easily be removed with these micro incisions. Because a lot of times with this vein, since it was superficial, were to be injected during an MFT procedure, it can leave dyschromia, which can take months to years to heal. So this is a 2-week healing time, and this vein will now be gone permanently. Thank you.
Before I go ahead and clean and dress my patient's legs, I will take all of my sharps off of the area and put them onto the tray so that I can properly dispose of them and have a safe work area. Next, I remove all the instruments that were used during the procedure, along with the tubing and the needle nest. And in my sterile sock pack comes a sterile towel as well, which I like to use to clean the patient's leg afterward if the provider did not use it during the procedure itself. Once the procedure is over, this no longer has to be a sterile work environment, so I put on my regular pink work gloves to clean the patient's leg. So I've gone ahead and grabbed one of our purple bibs out of the cupboard that we use for MFT setups, among other things. I like to place my dirty instruments into one of these and kind of wrap them up because we don't want them exposed carrying them through the hallway when we're cleaning up after our procedure. So I wrap my tools in these, and then I go ahead and I leave it on the counter to carry out when I'm done. If you haven't already gone ahead and pulled out the materials that you'll need to dress the patient's leg when the procedure's done, you're going to want to make sure that you take your dirty gloves off before reaching into the bin to grab your materials. If you have blood on your gloves, you could be exposing that to any other materials in the bin, which is potentially dangerous. So now I will go through the bin, pull everything that I need to dress the patient's leg, and then I will put a clean pair of gloves on before doing so. So one more time before dressing the leg, I like to go over it a little bit again, make sure that next to my incisions, her skin is very dry so that my steri strips stick. So the first thing that I do is I take my steri strips and I put one over every incision. As our provider, Tracy, was showing us in the video, occasionally one of the incisions might require a suture. If it did require a suture, it's not necessary to steri strip over it because the suture will be holding it closed. But because we don't have any sutures, I use the steri strips and I press down on one side and I kind of pull it over tightly and press it down on the other side so that it pulls that incision closed and it heals nicely. I do this over each incision to ensure that for a aesthetically pleasing cosmetic appearance afterwards, the incisions are barely detectable. Dab off a little bit again because some of our numbing fluid's leaking out here. And occasionally I will put a second steri strip over one to make sure that it's held down all the way. Next, after all the incisions are dressed, I take one of my ABD pads. Depending on the size of the vein and how big the area is, sometimes you might want to use two. I unfold it and I put it with the blue line facing down over all the steri strips. Any of the tumescent fluid that might leak out with a little bit of blood, this pad will help to absorb that. And to keep it in place, before I put her stocking on, I personally like to use one of our Swift wraps. They're really soft, they stay on the patient's leg well, and they have a self-closure Velcro. So now I kind of have the patient work with me a little bit, moving their leg, so that I can wrap all the way around the pad to hold it in place. After I'm done wrapping this, I will help put the patient's stocking on her. And this will hold everything in place. It is not completely necessary for them to wear their stocking for 48 hours, but we will always recommend that they do because it really helps with symptomatic relief. Any discomfort associated with the diseased veins or the procedures, the stocking will help to alleviate any of that discomfort. Okay, and where's your stocking at today? Over here on the counter. Okay. Now I can get this drape fully out of my way, and I'll have my patient turn and lay on her back because it's a little easier to get the stocking on that way. And then as soon as you're done dressing the area completely, you then help them put their stocking on just as you would for any other vein procedure. And it can go right over that dressing. Try not to leave the stocking bunched in any one area for too long because it can be uncomfortable for the patient. Try and pull it as tight as you can because you're going to want it to come over the top of the area that you just dressed. Now that the stocking is all the way on, our patient is free to stand up and change while I go make her next appointment. After putting all of our linens into the soiled linens basket, I then use the inside of my tray to throw away anything that I've used during this time. Keeps it all in the bag and makes it easier to throw away. I've already gone ahead and picked all of my sharps up by the end, the opposite of the point, and carefully place them into my sharps container so that I know there's nothing sharp in my bag and I'm safe to grab it and throw it away however I choose.